Namaste. Welcome to Ayur Bodha. Myself, Dr. Mahesh. Hope you are fine. So today we are going to discuss about selection of single herbs. Right? Selection of single herbs. How we have to select, on what grounds we have to select single herbs. Based as per my understanding, I do selection based on considering the importance, giving importance to Karya and Karana. That is Hetu and outcome. Karya and Karana. Based on that, I try for selecting the single herbs, right? So that the outcome can become a little bit more specific, or we can say we can get anticipated result, right? Okay, before going into the proper topic, there is Swakarya and Swami Karya. What I'm doing is Swami Karya and little Swakarya, because most of you are not watching the videos till the end. So there is something you should not miss. If you do not watch the video completely, you may miss. So that is why I thought let me tell that in the beginning. So wish you all a very happy Independence Day in advance, Independence Day wishes. And as part of Independence Day offer, the 50 hours dermatology course that we are offering a 1,000 rupees discount, right? From now, you can join till 16th evening, you can join our course with 1,000 rupees discount. While joining, you have to use the promo code Jai Bharat. You have to use Jai Bharat promo code and apply it, and you will directly get 1,000 rupees discount. Okay, so don't lose this opportunity. Okay, so as I told, selection of single herbs, usually consider the Shadurechana Shatashitya, the Shemanis are explained. Among them, how to select the drugs. So first we need to understand that the Shemanis or Ganas, how they are placed, or where they are actually, how they are acting, or that aspect we need to consider. So for that, Karya and Karana concept will help a lot. Now what is Karana? Karana is etiology. What is the cause of the disease, right? Karya is the result, what that etiological exposure has led to, right? What that etiological exposure has led to, what it has caused, right? So Karana, Hetu, Karya is result, right? So we consider example of Kandughna and Vishaghna, right? Kandughna and vishaghna we are going to consider for discussing how to select them. Same principle you can apply on all other dashamanis, right? But one thing you have to decide there which of the things that are explained there, karmas, like Krimigna, Kandughna, Triptigna, Da Prashamana, like that, Shotahara, like that, whatever, Mutra Virajana, Virechaniya, something like all those things which are acting on Karya, which are acting on Karma. That bifurcation we should do. Now, Kandu is Karya, right? Itching. Itching is Karya. Visha is Karma. They are not connected. I'm just trying to explain how to select the drugs, right? So, Kandu is Karya. It's a result. Visha is a Karana. It's a etiology, right? Now, we'll consider, when we are considering them Kandu, now Kandughna means acting on Karya. Kandughna drugs means they are acting on Karya. Vishaghna drugs means acting on Karma. So for another example, you can take Krimigna. Krimigna acting on, Krimi is Karya or Karana? Krimi is Karana, right? Now Krimi is leading to something else, right? So consider Krimigna acting on Karana. Krimi is leading to some diseases, so they are acting on Karma. So Kandughna dravyas they act on Karya, which is itching, Kandu. Vishaghna dravyas act on Karma, which is nothing but Visha, right? It's poison, Hetu. Now consider how to select them. What and all we have to consider while selecting the drugs that are acting on Karya and drugs that are acting on Karma. Right? We have separated. Consider you have gone through the Shadvirechana and Shatashriya there. All the karmas you have listed. So after listing, you have to bifurcate them under, are they acting on Karya or acting on Karma, right? So then again in Karya drugs acting on Karya, 10 are there. Which one to select? How to decide them? How to take a call on that? So what we have to consider for that? Consider, for example, Kandughna, few examples, common examples I have taken which are commonly prescribed, right? Chandana is there, Nimba is there, Karanja is there, Sarshapa. These four we are taking. Now, for example, there is a patient with itching. Can we prescribe any of these? Or can we prescribe these 4 drugs like Nimba, Chandana, Karanja or Sarshapa in any type of condition where itching is there? Can we do like that? No. If we do, we may not get 100% result. For example, consider them Chandana, Nimba. Example like what we are going to considering. For example, we are considering Virya. Chandana and Nimba are Shita Virya. Sarshapa and Karanja are Ushna Virya. Now, can we use them in any type of itching, in any type of presentation, any condition? Now, for example, in both these conditions, both are tinea, right? Fungal infections, dadru. In both these conditions, severe itching is there. Severe itching is there. But what difference they have? Both have common is itching. But what is the difference in them? What is the difference in them? What you make out maybe the probable difference in these two? What is the difference? Right? The first one, what you are seeing is Pitta dominant. Second one is Kapha Vata dominant. The first one is Pitta dominant. Second one is Kapha Vata dominant. So, what we have to consider when we are selecting drugs acting on Karya? So, what we have to consider? What is the difference? Dosha involvement is different. Right? Dosha involvement is different. So, when we are selecting dravyas that are acting on Karya, we need to give importance to the dosha association. For example, Sravahara Dravya is there. Now, Srava, Kapha dominant Srava will be different, Pittaja Srava will be different. Like Pittaja Srava will be Lasikadya, right? Rasika, thin water like. Kaphaja Srava will be thick, Ghana Srava. Can we use same drug for both the Srava? No. Right? There is itching in eczema. There is itching in urticaria. Can we use same dravya in both, in urticaria as well as in eczema? No, because dosha assessment, dosha involvement itself is different. So when you are selecting drugs acting on Karya, then not you, we all have to. When we are selecting any drugs acting on Karya, we need to give importance to the dosha involved. Simple example, you go to the Vatavadis explained in Sushruta. There, Padadaha is also one of the Vatasana Vadi. Daha is Karya. Now, Daha Prashamana drugs, if we consider, can we use them there? Or there are drugs which are some are Snigdha, some are Ruksha. Right? Some are Snigdha, Ushna, some are Ruksha, Shita, but both are Daha Prashamana. Consider both are Daha Prashamana. Or both are Daha Prashamana, one is Ruksha, another one is Snigdha. Which one we are going to select? In Patadaha explained in the Vataveda by Acharya Sushruta. Now, so that is why when we are selecting drugs for the karmas, for acting that are acting on the Karya, that are acting on the outcomes or clinical presentations, then we need to choose them based on their doshagnata, along with Karya, doshagnata. Shotahara, Kafagna, Pittagna, Vatagna. Kandughna, Kafagna, Vatagna, Pittagna. Right? Karya, Daha Prashamana. Which? Pitta associated, Vata associated, Kapha associated. Which dominant? Kapha dominant, Pitta dominant, Vata dominant. In all Daha will be there. So, which type of dravya we have to select, that is dependent on the dosha assessment. Right? So, overall, if you want to select the drugs that are acting on Karya, we need to give importance to dosha involved in that presentation. Right? Now, I think Chandana, Nimba, Karanja, Sarshapa. Now you can decide which one to take where. Hope you have understood, right? Now consider Vishaghna. Vishaghna, some examples. Haridra, Shirisha, Chandana, Manjishta, Shleshmataka. Now here what we need to consider. Visha is Visha. Vishaghna, Visha. Can we use them in any Visha again? To some extent, okay, no problem. Or can we make mixture of all the 10 and give? Yes, that is also okay. Acharya has told for that also, right? Charkacharya has told. But to get 100% outcome, What is to be done? So while selecting the drugs that are acting on karana, we need to have minimum two things I usually give importance. The first one is, for example, in Visha, type of Visha. Is a Stavara Visha, Jangam Visha. In Jangam Visha, Sarpa Visha, Luta Visha, Kita Visha, or Rushtika Visha. Now, for example, Shleshmataka, very good for Luta Visha. Sirisha, said to be very good for Darvikaradamsha. Likewise, what we are selecting there based on? We are selecting based on the type of Visha, nature of the Hetu. Second important thing that we need to consider, where we are not able to differentiate what type of Visha. Visha is okay here, but other than Vishaghna is okay. If Krimigna is there, where how to select? Then we need to give importance to the area of action of that dravya or dhatu, on which dhatu that particular dravya is going to act. Right? So when we are selecting drugs that are acting on karana, dhatu should be given importance, on which dhatu it is going to act. Right? I will make one video on rasayanas. Like for example, rasayana, we say rasayana. When we are selecting them, are they going to act on sarva dhatus? There are some rasayanas which act on all the dhatus. But disease specific, if we are prescribing rasayanas, how they are prescribed, how to understand them, then that particular rasayana should be having affinity or effects on that particular dhatu affected or the system affected. So when we are selecting drugs that act on karana, at that time we need to be giving importance to the dhatu and the swabhava of the karana. Right? I think it is clear. Right? So example, again I told you Maricha, Nirgundi, Vidanga, Gokshura. These all are Krimigna. Right? But all have different attributions. Their Rasaguna Yuripara, Prabhava, Karma, all are different. So they are to be selected based on which dhatu they are going to act or which system they are going to act. Right? So homework among just example, like you take example of Vishaghna and Krimigna and try to assess which ingredient, which dravya among Vishaghna Shemani is probably having effect on which dhatu or which type of Visha, or which Krimigna is probably having which type of Krimi, or which dhatu with a Krimi, or Krimi associated with which dhatu. Now Krimi means don't take just the Krimis, what we will have a separate discussion on Krimigna drugs. Okay, so please do this homework to understand better, and I'm very sure if you do that, your selection of single herbs will be improved a lot. It will be improved a lot. Okay, so thank you for watching this video, and don't forget to visit our website www.ayurskills.com, and I have given even the link to the course in the comments in the description, and visit there, use the promo code Jai Bharat and get 1,000 rupees discount and join our 50 hours dermatology course at just 6,000 rupees. Thank you for watching. See you again in next video. Once again, happy Independence Day. Namaste.